Hi, I'm Natalie Houser, a physician assistant in family medicine, and this is my journey to becoming a PA.
I'm accompanied by my good friend Natalie, practicing PA, and I'm excited to hear about her journey to becoming a PA. She has such an amazing story, and I'm so glad to share it with all you guys today. So Natalie, I know you have this unique backstory, but what was kind of one thing or that little flick of the switch that helped you want to become a PA?
Well, first, thanks for having me. So the first thing that put me in the PA mindset was actually a medical director at UMD&J, which is a medical school in New Jersey. I had a difficult time with testing, and he said, "Have you considered PA?" That was the first time I'd ever heard of it.
Wow.
And I started doing research, and I noticed that it was a profession where it had a lot of flexibility,
Mm-hmm.
and so you could be trained and everything, and that was very attractive to me because I knew I wanted to do neurosurgery, but then I said, but what if I like something else, like family med or derm? And I love the medical curriculum, so I said, all right, let me look more into this. And I just started finding PAs in the area and seeing if I could shadow them. And I didn't know that one of the doctors I had, who I thought was a doctor, was actually a PA.
Yeah, that's something really unique that happens probably more often than we think. Is myself the same thing. Growing up, I saw a PA as my primary care provider, and I didn't really know what a PA was. I didn't realize it until I was in high school. And then when it came time for me that I realized I want to become a PA, I reached back to her and I was like, hey, all these years you've been seeing me as a patient, do you mind helping me out? I want to become a PA. And she helped me out and became a good mentor for me. So it's just so unique how these things happen.
Right.
And I know you wanted to be involved in medicine from such a young age, but once you kind of realize PA and you're going to go in 100%, you talked about shadowing, but a lot of people have a difficult time finding PAs to shadow. Is there anything you could recommend or any advice that things you did that kind of helped you connect with PAs to shadow?
Certainly. I did the old school way. I got a Yellow Pages for the city that I lived in. And I went to the medical section and I called all the doctors because I thought to myself, the doctors would have a PA or a nurse practitioner or someone there that I could shadow.
Mm-hmm.
So I called 20 people and the 21st person said, okay, sure, be at my office tomorrow at 7:30 in the morning.
Wow.
So I got there, he had a PA, he was a DO, and I got to shadow him, I got to shadow his PA and see the relationship between the two.
That's amazing. It just goes to show that if you have the tenacity and the willpower, you're going to make it happen. You're going to be able to succeed. And a lot of people get discouraged. I bet you so many other people out there would have called 5 and then given up, and then 10 and then given up. But you never know. You just got to keep at it. And the same kind of holds true. We'll get into this more when it's time to apply to PA school and get interviews. A lot of people get discouraged right away. They say, oh, that person didn't accept me, or that person doesn't want to let me shadow, so no one wants to. You got to get out of that mindset and realize, no, just because one person said no doesn't mean that it's a no for every single person. Did you shadow other professions as well?
I did, mainly MDs. I found that it was very easy to shadow medical doctors because they either own their practice, so they set the rules, or they set the law with pre-PA or pre-med students coming in. I found that when trying to shadow some PAs, it was a little more kind of red tape to go through, office rules that you had to go through, but I knew that a lot of medical doctors had PAs, so that was my way around it. I shadowed surgeons before and nurse practitioners, and I wanted to shadow everyone, every position in the medical field to assure that my choice for going into PA was really what I wanted to do.
That's an excellent piece of advice, because a lot of people, they'd say, I want to be in this profession, and they never actually get any experience or shadow anyone, and then you put all this time and effort and you get into it and you realize, wait a minute, that's not what I wanted to do.
Yes.
And it's just, for some people it's okay to switch mid-career later on in life, but others it's like, oh, I kind of maybe wasted this time, or would have been more pleased if I started sooner. And so that's really great that you kind of got everyone's unique perspective on medicine. Did you feel that kind of helped you hone in on the understanding of the PA profession?
Definitely, because when I sat down to do my interview, they said, you want to contribute to medicine, why not nurse practitioner? Why not medical doctor? Why not DO? Why not physical therapist? And I knew my answers because I had shadowed other professional people, and I was like, okay, this is why. And I love the other professions, however, I can contribute more as a PA.
I think it just opens your eyes to the importance of the team effort and healthcare being a team approach.
Exactly.
And that just really helps give a better understanding of a PA's role in healthcare and how you could kind of utilize your skills to their maximum benefit. So that's really great you had that opportunity. Now you got into doing some shadowing. Now let's kind of move forward and talk about time to apply. So how many programs did you apply to when you first started out?
So my first mistake was when I decided that this is what I wanted to do. I said, okay, I'm only going to apply to the school that was closest to me. And I was living in New Jersey at the time. And I had all the prereqs and I had all the qualifications that you needed. And I was one day late on CASPA. So I tried calling them up. I had this long story of why I was one day late, and they were like, no, the deadline is the deadline. So the next year I said, all right, I'm going to apply to 2 schools. And I applied to a school in New Jersey and then also a school close to my hometown in California. And that was my first go-round. I interviewed and I got accepted, and then the school lost their accreditation.
Wow.
And so that was my eye-opener of, the 21 phone calls that I made that day. I didn't take my own advice to apply to more schools. I only applied to 2 schools. And then my third time, or really my second time applying, I applied to probably 15 schools.
Okay. Yeah, one thing, a lot of people, they reach out to me and they say, Anthony, how many schools should I apply to? And there's no right answer. Everyone's background is unique. Everyone's financial situation is different. And someone will say, I want to apply to 20 schools. They're like, all right, have fun. Just realize that's going to be really expensive, especially if you get into interviews and having to travel. But yeah, and then the flip side is all you need to get into one PA school and you're set. So I know most recent data shows that the average number of programs people apply to is 7. Yeah. I personally applied to 5. And so it just kind of goes to show, like she said, you get a no, and then you kind of widen the net a little bit, and you just keep at it until you get accepted. So you put in your applications. Now it's the interview time, and I know a lot of people get really stressed out, anxious, a lot of high anxiety levels when it's interview time.
Right.
Is there any aspect of like the interview that stood out to you? Not like giving particular information about the interview process, but just something you know about now that you kind of wish you had a better understanding of when you're interviewing at programs?
Well, the one thing that I always think of and I tell people is that I didn't know I was just going in to show them that I was a person on my CASPA application. I thought I was going in and I'm competing with other applicants, and you are, but if they call you in for an interview, that's because you meet their qualifications. Yeah,
and I agree 100%. If you get offered an interview, that means you have what it takes to be in their program.
When you think that I have what it takes, I am supposed to be here, it just takes away so much stress and anxiety interview day. And I was the last interview at the program that I attended, and I didn't interview until March. So everyone had a lot of options by that time. And while I was there, I was so nervous. And the person who interviewed me said, "You're supposed to be here. Now I want you to tell me why you're here."
And it's such a difficult mindset to have, especially if you haven't experienced an interview before. We have to get out of the mindset of it's a competition with everyone else, that you deserve to be there. And the other thing to think of is you're really needing to show who you are, and not just, like you mentioned, not just that CASPA application. So they read through all your info, they know your stats, but it's not personable. And now you have your interview so they could meet the real person that you said you are. So you get into PA school, you're excited, everything's going your way. All that hard work's paying off, and now it's didactic year. I myself had a tough time during didactic year. How about your experience? Did you have to learn a new way of study habits? Did you have to incorporate something new? How did you tackle that?
Well, thankfully, I learned how I learned before I got into PA school, and that's important. I tackled all of the academic issues that I had before PA school right away because I didn't want to get into PA school and then be dismissed. So I figured out what my issues were, and I would sometimes study for hours, and then after I was done, I didn't know anything. So I started doing questions, and I said, all right, questions work for me. And once I got into PA school, practice test and practice questions really worked for me. Listening to lectures, group studying, all those things worked. And not studying with friends, because then it became more of a social time and not actually studying. So studying with people that, you know, I didn't particularly hang out with on the weekends.
You have to kind of reinvent yourself in the way you study. And it was nice that you had it figured out beforehand. I myself personally, I got through undergrad, did pretty well, and studied a really particular way. And then I get to PA school, and within like the first 2 months, reality sets in. And the way I studied that helped me be successful in the past is just for some reason not doing it for me. I like barely passing exams, super stressed out. I had to take a second and kind of reevaluate what I was doing. And actually what helped me was getting into group studies. And not necessarily with my friends where it turns into social hour, but kind of, I was always by myself doing my own thing. But once I got into the group atmosphere, then we could bounce ideas off of each other. And I actually realized the things that I thought were important, the professor didn't think was important. And that doesn't make for a good grade on the exam. But being in like the group atmosphere, someone would say, oh, they really honed on this is important, you should study, and that kind of helped me kind of evolve and do better academically. So enough on the stresses of didactic year, because I just want to forget all about that.
Right.
Then you get to clinical year, and you're thinking, this is going to be cake. I know all the stuff in the book. Bring me that first patient. And then again, the reality sets in.
Oh,
how was it for you?
It was not good in the beginning, to be completely honest. My first rotation was pediatrics, and we at my program we made a wish list, and you rank it from least likely to the one that you just really want to be in. And my first one was pediatrics. I wrote extra notes. I don't like pediatrics. I don't want to deal with parents. Please put me here first. What I didn't know is rotation started in January, and that's flu, virus, cold season. And the first patient my preceptor passed me was a 7-day-old baby, and she's like, here you go. Wow. And I was like, no. In the room, in front of the patient, and the patients, the parents, everything. And she just said, don't ever say that again. You have to see the patients. You have to touch the patients. And I had been in didactic for over a year, touching pages and iPads, and now to go out and touch patients, I thought I was ready, and I was like, I'm not ready, but it's do it now or never when you're on rotations. Oh,
definitely. It's a whole different ball game, but like you said, you have to touch the patient. It's do or die. You really have to get involved and just go for it. One thing I recommend people do is they know you're going to make mistakes as a student, so take the risks. And of course, you don't want to harm patients and don't make mistakes on purpose, but you really need to get out of your comfort zone. Did you feel that the rotations got you out of your comfort zone?
Oh, definitely. And I also felt that telling my preceptors what number rotation it was for me helped them with the idea of like how much hand-holding I needed. Okay. So once I said, this is my very first rotation, then she's like, okay, this is how you hold a baby, this is how you look in the air. And once I got to like my 8th rotation, I'm like, this is my 8th rotation. They're like, okay, go see this patient for me. So just being open with the preceptor and telling them what your comfort zone, where you were, and then they can either push that a little bit or they know how to work with you.
Yeah, and that's excellent. I think that's a great piece of advice I don't really hear that often is when you first meet with your preceptor, let them know kind of the level you're at. And I think that's really great. It kind of helps them along the road there, and so they're not upset at you if you didn't do something a certain way.
Exactly.
Because it's your first rotation, you don't even know which side is up, you don't even know what side of the stethoscope you're really supposed to be using.
Yeah.
The textbook said use the bell, but I hear it better with the diaphragm. It's like all these weird things that happen when you're on your clinical year. So you're powering through clinical year, and then it's time to take the big old test, the PANTS.
Right.
So the certification exam, was there anything specific that you did to help you study?
Well, I'll start by saying I was the least likely to pass in my class. I was labeled as the least likely.
I think it's horrible that they gave that label to someone.
I don't know if they tried to do a little reverse psychology.
Yeah, some motivation.
But I was busy looking for a job when everyone was studying for the summative exam. So most programs have an exam that you take at the end. And I said, I'm just going to wing it. You know, I've gone through didactic, I've gone through rotations, and forget the summative exam.
Yeah.
But what I didn't know is that you need to finish and close all business that you have with your PA program, because you have to be qualified to take the PANTS, and that means you've closed everything that you have with your program. So when they told me that I did horrible on the summative exam and that I needed to stay after for tutoring so that I could pass the PANTS, I was upset, but it actually helped me. So I did tutoring one-on-one with the university, and I kept my resources limited. It's very easy to get distracted when you're sitting in class and everyone's like, I'm using this, or I'm using this review, I'm doing this review course.
There's so many options out there.
Yeah, there's so many options there, and I felt that I started to like just wanting to have them all. And I would sit down and study, and I spent more time, you know how you search through Netflix trying to find something to watch? I spent more time trying to see which one I was going to use as opposed to studying, that I had to limit my resources to the max of 5.
Oh, that's good advice. So you touched on something. You were looking for a job while everyone else was studying for their exam.
Yes.
I really respect that, and I think that's thinking outside the box. So I want to learn more about that.
I'm a National Health Service Corps scholar, so I got my 3 years of PA school paid for, and I wanted a job in California. I heard that the competition was really high, so with the NHSC scholarship, you have to work at a qualified clinic, and they have a score that you have to meet, a HPSA score. So everyone told me, oh, it's impossible to get a job in California. So I said, I'm going to make it possible.
Nice.
And November, no one's really graduating at that time. Programs usually are ending in December, March, May, summertime. So I said, I'm going to start interviewing in November. I got my cover letter together, and everyone was studying for the summative exam, the PANTS, and I said, I need a job, because if I have a job with a signed contract, I will be less anxious about taking tests.
That's true.
And that's what I told myself. If I had it, I would say, okay, now I can focus on the PANTS. And I just start sending cover letters to companies. And I said, you know, my name's Natalie, I'm an NHSC scholar, I want to work in the community, and I just gave a little history of myself and my resume, and surprisingly, every company I interviewed responded to me.
Wow.
And I was very clear that I wasn't graduating for another 6 months, and that I probably wasn't taking my PANTS for another 7 or 8 months, and they were like, that's fine. We see that you're ambitious, you're passionate about it, and we want to interview you.
That's amazing.
And every interview I went on, I got an offer. Wow. And I didn't know what I was doing, and I didn't tell anyone. And when I started telling people in my class, they're like, you're doing what? And I got my job, I signed my first contract, and it was still November, and I was like, okay, now I can relax and focus on the PANTS.
Yeah, that's actually, so when you're going through the timeline, you take your summit exams, you take your PANTS, then your people look for a job. Maybe you're like getting your licensure set, and then you're looking for a job, and that's most people. And then you totally like flip the script, and you're like, nope, I got a job, I'm good. Let's just rock the tests, and I'm golden. And
Yes.
I just think it's testament to your work ethic and how successful you've become, because you're looking at it differently, and you play it to your advantage. And I think that's amazing. Now, you touched on the scholarship that you received. Not very many people out there are familiar with it. Do you mind discussing a little bit about it, and like when people apply and get accepted?
So once you're accepted into an accredited program, PA program, you can apply. And if you've gotten into a program, you're a great candidate for the NHSC Scholar. They are looking for people that are committed to serving underserved communities. It could be rural communities. I mean, I work in downtown LA, so it's a range of communities. And you apply and you wait to hear back from them. I didn't hear back until I was already in the program for 2 months. And they pay for all of the years of your program if you want to accept all the years, so it'll be 2 or 3 years. And then once you accept it, they return your financial aid, whatever you were given, and so they figure out all the money part of it.
Right.
You also get a monthly stipend. I got $1,200 a month while in PA school.
Wow,
So
that's
you
nice.
can't work, but I had this $1,200
Right.
and it really helped. And it's based on the cost of living in the state that you're in.
Mm-hmm.
So California is a little bit up there, and I got $1,200 a month. They took care of all the financial aid. Every 6 months, I had to submit grades to let them know I was in good standing. So you have to maintain a passing GPA. And then when I graduated, I was given 6 months to find a job, but I already found a job.
Right, nice.
And it doesn't affect my salary at all. That's a lot of people think, well, if you have a scholarship, the company will offer you less. It doesn't have anything to do with the company that hired me. And you work for the equivalent of the time that they paid for. So if your program is 2 years, you work 2 years at the underserved community. If my program is 3 years, so I worked for 3 years.
And are you still at that same place? Or
I'm still at the same place that hired me 6 months
Nice.
before graduation.
Ah, it's amazing. That's just such a great story. I love hearing people's journey and hearing success stories like this. It's just
Thanks.
so exciting. Now, so you're working and you're doing so many amazing things. I want to just briefly touch on you wrote a book and I read it and it's really great and eye-opening to your background. I felt
Thank you.
we knew each other, but once I read the book I was like, wow, I'm just so amazed by all your accomplishments. Maybe let's like briefly tell people kind of what was the goal of the book, or what was something you wanted to see based off you writing the book.
So the title is the Compton Diagnosis. And I came up with that title because as providers, you and I, we diagnose people every day, whether it's with osteoarthritis or diabetes. And, you know, the patients take this diagnosis and they go home and they deal with it and they channel through it, and they're either really motivated about it to getting rid of that diagnosis, or they become that diagnosis. And I found that too often pre-med students or pre-PAs, we give up when we're diagnosed with something, whether it's test-taking anxiety or needing to reapply another cycle for PA school, and we give up.
Mm-hmm.
And I felt that we are missing out on a lot of great providers because we prematurely diagnose ourselves with failure. So the idea of the book was to transparently tell my story and all the obstacles that I overcame and how I am where I am today.
Right. I think something, especially on social media, I kind of see this. People look at a person and they say they're so successful, they must have had it easy, they must have had their hand held, they must have had something help them get to where they are, and I'm never going to have that opportunity. But hearing stories like yours, and I've told my story a number of times, and you realize, no, it's the hard work, the determination, one step at a time, and things become, you achieve these goals and you become successful because of all these little steps and obstacles and hardships that you overcome. So again, an amazing book, and I'm so excited for you and all the success that you've had with it. And I'd like to close our interview with a segment called Drop Some Knowledge. So I'd like you to think of maybe the most important tip or something that if you knew this prior to applying that would have really helped you, that you could share with aspiring PAs out there.
Trying to accomplish your career goals is probably one of the hardest things that you would ever do in life. And once you do it and you start contributing to the field that you want to be in, you will be so thankful that you did not quit it.
There you go. Keep at it. In the end, it all works out. Thank you very much, Natalie, for joining me today.
Thanks for having me.
Such an honor. And I'm excited to talk with you later.
Thank you so much.